Good day, everyone. I hope you're all doing well, and welcome to all the new subscribers on this channel. We are on our way to 40,000 subscribers now, with just over 400 subscribers to go. In the news is an article that is extremely relevant right now. I know there's a lot of news out there, there's a lot of things happening in the world, but this specific article is extremely relevant to our freedom, and especially if you look at things happening on a global scale. And this specific article is from the Daily Maverick, and the headline reads: South Africa's former health DG, or Director General, to lead development of a future pandemic treaty for the World Health Organization. Now, understanding what it means that there will actually be a worldwide treaty that will be signed to say that pandemics will be treated a certain way worldwide should really have you concerned about your freedoms, because these are governments working with other governments that we did not elect to come up with treaties and decisions for us as South African people. And I will get right into this article as usual. The link to the article will be in the description below this video, as well as in the first comment. So you can go and find it there and read it yourself. And it says here, South Africa's health expert Precious Matsoso will be co-chairing a new body set up by the World Health Organization to draw up a pandemic treaty that will set out global principles for effective pandemic preparedness and response. Now, what they call effective and what they call to be really prepared for a pandemic, and even the definitions of a pandemic, these are all things that will be up for debate. These are things that will be taken to court in many countries. And I think in many countries around the world, people will realize that they've been fooled, that they don't have the protection they thought they had. And it's unfortunate that they will start to realize this. The only fortunate thing is, once they realize this, they will hopefully go over into changing their lives and taking action. And that is exactly what we need. And even if that action is to spread awareness and to want to change the system in their country, wherever you are, to something that is more free. Precious Matsoso, the Director General of the Department of Health between 2010 and 2019, has been appointed as the co-chair of a globally important intergovernmental negotiating body, a INB, tasked by the World Health Assembly, the WHA, with drawing up a draft pandemic preparedness treaty. Now, a treaty is something signed between many other countries, and a treaty or different groups. A treaty, normally happens post wartime or during wartime. The World Health, the WHA, is the annual meeting of members of the World Health Organization that sets its priorities and debates on key policy areas. Matsoso was proposed by South Africa's Minister of Health, and with the endorsement of African ambassadors to the WHA, she represents the African region on a 6-person bureau made up of Brazil, Egypt, Netherlands, Japan, and Thailand. Roland Dries, her co-chair, is Director of International Affairs of the Dutch Ministry of Health. The bureau, which has its first meeting in February of 2022, has its work cut out. So they've already started, and they are actively doing work to establish this treaty. It must develop a working draft in consultation with member states and civil society stakeholders by August. Now, understand what they mean by civil society stakeholders. They might approach industry, they might approach NGOs, many organizations that they say are the spokespeople for civil society. So if you are not involved in one of these organizations, they're not going to hear your voice. And you have to ask yourself, is this the way that you actually do something like this? Because they will tell the whole world that they have negotiated or consulted with the citizens of the world when coming up with this treaty. In his address to the Bureau, World Health Organization Director General Tedros Ghebreyesus described it as a momentous undertaking and a necessary one, because the COVID-19 pandemic has shown that the status quo is not good enough to protect our communities, our societies, and our economies. Now, you can read between the lines as to what this means. Next headline: global discussion. A global discussion has now commenced to consider what issues must be covered by such an instrument. The World Health Organization, member states, civil society, and other stakeholders are being asked what issues they consider critical and why. The international health regulations, for example, are supposed to be legally binding on states, but were often ignored during the COVID pandemic. They need to be shored up with a new treaty. So, what they are saying is that many people just weren't obeying these specific rules and regulations that were put out in South Africa, for instance, during the COVID-19 pandemic, or the state of disaster, as they call it. And he's saying here that it needs to be shored up with a new treaty. What does this mean? What does it mean for the people of South Africa? And how will our government go about seeing that we're at the forefront of leading this treaty? What role will they play in actually shoring up the responses to how we behave? To this end, the World Health Organization is beginning public hearings this week in every corner of the world, asking what substantive elements should be included in a new international instrument on pandemic preparedness and response. The discussions are meant to be accompanied by country-level consultations. Now, the first thing I can tell you is they are not speaking to people everywhere in the world. This is the impression they want you to give. And if you go to Lauren Evanthia, that YouTube channel, you will understand how all these things are sugar-coated. People are wined and dined, and it's just a couple of people that normally rock up to these participative events, and then the governments, or in this case the World Health Organization, will claim that the world's populace were actually consulted in the process. According to Matsoso, the World Health Organization is also planning to set up working groups for a deep dive into the issues that are identified. This will prepare the foundation for later negotiations and regional meetings between August and October 2022 to engage member states and stakeholders. The ultimate aim is for a new treaty to be adopted in 2024. Now, there you have a timeline. You need to understand why they want to adopt the treaty in 2024. Pandemic conventions, and this is where things get interesting, and I'm not going to go through the entire article, so please go and read the rest of the article on pandemic conventions, etc. I'll just cover the first part. COVID-19 and the chaotic, uncoordinated, and inequitable response of states has shown the devastation that pandemics can wreak. So, fear-mongering. A study published in The Lancet estimates that up to 80 million people had died of SARS-CoV-2 by the end of 2021. So this is according to their statistics. The death toll in Africa is much higher than what was at first estimated. Recorded excess deaths in South Africa had reached more than 303,000 by the beginning of April 2022. But in addition, there have been uncounted deaths because of the neglect of our diseases during COVID and the social and economic consequences of the way states have responded. This toll is only just beginning to be counted. So I don't think a lot of people understand what this means. So what they are saying is, even although our government might have praised itself for the actions that it took, the World Health Organization said that it wasn't good enough, it wasn't stringent enough, and they didn't get people to stick to the rules and regulations that they've put out there. And what they are saying is that there were a lot more deaths than were initially reported because of this. And I'm not going to get into the semantics or the details of this. What this means is a treaty that will worldwide take away more of your freedom. That is the bottom line here. And I want you to understand that and prepare for it. So 2024, their plan is to have this treaty signed between many countries. And this is not something that we can stop. All we can do is try and create a new governance system. In South Africa 2024, we have a chance to do that. Thank you very much for watching this video. If you are a new subscriber to this channel, please go and watch the Moments in Time and the Question Everything series. You can find playlists on those video series and go and spend the time and watch them so you understand what this channel is about. There's over 800 videos on this channel where you can go back and find topics that you might find interesting. You will be able to find all the members' content if you join up as a member on this channel, and there you will get deep detailed information that will be able to help you to make decisions for your future. And it is giving my perspective on history as well as the future. Thank you very much for watching this video. Till the next video.